an open access. So the most important part for this treatment is to choose the patients, because sometimes, as you already know, the sensitivity is not due to a dental hypersensitivity, but it's due to something else. So let's define dental hypersensitivity first of all, theoretically or microscopically. Till this day, the most acceptable theory for dental hypersensitivity is Brainstorm's hydrodynamic theory, excuse me. So according to Brainstorm, a stimulus will cause a displacement of the fluids inside these dentinal tubules, and this displacement will cause in its turn a deformation of the nerves ending, and therefore we will have the sensation of pain. So if we can somehow stop this stimulus from causing a fluid displacement, we will have no pain at all, so the patient will be relieved. This is theoretically, but of course for us in the clinics, this is not our concern. We want to choose the patients clinically. So clinically, what is dental hypersensitivity? We can define it as a pain that is coming from an exposed dentin or a naked dentin, and it is in a response to a stimulus, so we have to have a stimulus, and there is no other dental defect or disease on this tooth. So if we have, for example, this case with no other dental decay, no other dental defect, the occlusion is fine, so we can consider this dental hypersensitivity. If there's a stimulated pain, so the pain must be stimulated, provoked, and short in time. Okay, I will give you the description of the pain. So this is a good case to treat dental hypersensitivity, but this is a bad case because in this case, the problem is this old composite filling that is not well adapted. So maybe you just have to change this composite filling. If you apply the protocol with the laser that I'm going to give you, in this case, of course, the sensitivity will be worse. Okay, so we have to choose the patients. In general, the pain of the dental hypersensitivity is short and sharp. It is non-spontaneous, so it is provoked, and in general, it's reversible. So if you do a jet of air and water for 2 seconds, the patient will feel a pain and then it will go immediately. It is a reversible pain. So let's talk about the parameters, and then we will check the protocol. The parameters are the 980 nanometer wavelength of the Smart M Pro, a power of 1 watt, it's enough, in a continuous mode, and in a non-contact and contact mode. So I will explain how in the protocol we will work in a non-contact and contact mode. And the most important thing was that we have chosen these parameters, but before doing our in vivo study, we wanted to make sure that these parameters are safe and our protocol is safe on the humans. So before doing the in vivo study, we had to do an in vitro study. And how can we, what are the things that we have to consider? They are 2 things. First of all, we have to check the safety of our suggested treatment. And secondly, we have to check the efficiency. So let's see first the efficiency. These are extracted molars. We took extracted molars. We added EDTA for 5 minutes in order to mimic the real cases in the clinic. So now we have open tubules, and according to Brainstorm, these open tubules are causing the dental hypersensitivity. So we applied on these extracted molars this treatment of dental hypersensitivity, and we checked the results. We are using here a scanning electron microscopy. We found after the treatment that we had almost a complete obliteration or narrowing of the dentinal tubules. So we can say that our treatment is efficient. We were happy to see the results because there was a narrowing of these dentinal tubules. We still have to check the safety of the treatment. This is the most important part. So, as I've said, if you remember in the bleaching, the same concept. We don't want to have an increase in temperature that is greater than 3 degrees Celsius. This is the maximum that we can have. So we've added a thermoconductor and thermoreceptor inside the chamber of the pulp, and we did the exact same procedure, the exact same protocol, and we've checked the rise in temperature we found that the mean value of pulp temperature increased. And here I'm talking about the mean value because we will do this protocol like 15 times to be sure. And the mean value was 1.2. This is smaller than 3 degrees Celsius. So we can say that this protocol is safe according to the scanning electron microscopy. We saw that this protocol can be efficient, and according to this study, this pulp temperature increase study, we can say that this protocol is safe on the pulp. So now we did our in vivo study on, I think, 167 patients, okay? So let's talk in details about the protocol. You have the parameters. Now I will give you in details the protocol, and I think you can apply this treatment for dental hypersensitivity maybe tomorrow. So the most important part, of course, is to protect the gingiva with a liquid rubber dam. And the key for our success, I think, is to add the graphite paste. So the graphite paste is just a graphite and distilled in water. And distilled water, you will mix this graphite with the water. You will apply it on the naked dentin, on the surface of the dentin that you want to irradiate, and you will start, okay? Two advantages will be obtained from this graphite paste. First of all the energy will be superficial because, as you know, in the laser-tissue interaction, the diode laser, the 980 nanometer wavelength, is well absorbed in the pigmentation. So all this energy will be absorbed by the graphite paste. So I will have a better results. I will have better obliteration, better narrowing of the dentinal tubules with only 1 watt, because the absorption is more important on the graphite, on the black color. And another advantage is I am somehow protecting the pulp, because all the energy is superficial on the graphite paste. So the pulp is somehow safe. I'm protecting the pulp, okay? So the key is to apply the graphite paste on the naked dentin, on the tooth that you want to treat, and then to irradiate with the laser with the parameters that I gave, and in a tangential incidence, so in an angle of almost 45 degrees, and in a non-contact mode in the beginning, because this protocol can be made without anesthesia, okay? So you will start in a non-contact mode, and gently you will start to apply in a contact mode. And when you remove all the graphite with the laser, you have to see this reaction that the graphite is, there's like a micro explosion, and the graphite is vaporizing. When you have this, you can say that it's enough, you can stop. Okay, this is the protocol. In some cases, if there's a severe dentinal hypersensitivity, it's okay to do a little bit of periapical anesthesia before starting the protocol. So this is the graphite paste. Now, of course, depending on the country, you will have different type of graphite paste, and you have just to mix it with distilled water and to add it on the naked dentin. So this is the protocol of the dental hypersensitivity. Now back to our in vivo study, we saw that there was a significant, statistically significant decrease in the pain immediately after the treatment, because we did this treatment with no anesthesia. So before treatment, we asked the patients to evaluate their pain from 0 to 10. We will take a jet of air and water, we will provoke the pain, and we will ask them to measure their pain from 0 to 10. 0 represents no pain at all, and 10 represents the greatest pain. So the patients will measure their pain, and we calculated the mean average. It was 6 point something. And after the treatment, immediately at the same session, we asked the patient to evaluate his pain. So we had a significant decrease in the pain. And what's very interesting is that the treatment was stable in time. So there is no significant difference between P after, the pain after, and pain after 6 months, okay? So this is a case, as I've said, I have to protect the gingiva. I will apply the graphite paste, and I will stop when the graphite paste is removed, okay? So maybe now if you want to ask me questions about the in-office bleaching and about the dental hypersensitivity, I think these are two interesting topics.